start. So I'm gonna place my gloves on, and I'm gonna start by assessing the head. Any pain?
No.
Tenderness? No?
No.
Okay. Let me look at, can you turn that way? I'm gonna look behind your ear. Okay. That way. Okay. So hair, it's clean and dry. Also skin is intact. I'm gonna be taking a look inside of your ear, okay? Can you look that way for me? Thank you. I'm gonna pull back and up to open the ear canal. Okay, just mild cerumen. Can you turn that way for me now? I'm gonna pull the peanut back and up to open the ear canal. Okay, and it's mild cerumen, okay? Now I'm gonna be assessing your eyes, okay? Your eyesight. Can you please stare here at my nose? I'm gonna flash each eye. I'm gonna divide it with my hand, okay? Okay, now without moving your head, can you please follow my pen? Okay, patient has equal pupils reacted to light and accommodation. So now what I'm going to be doing, I'm going to be checking for your upper extremities to see if you have any limitations with range of motion. So you're going to mimic me. All the way up. Any pain?
No.
To the sides. All the way down. There you go. Can you flex for me? Okay. Now just your hands. Flex. Okay. So now I'm going to be doing it with resistance. Okay. So you're going to place your arms straight for me. Up. Okay. Down. Okay. And now place just your forearms up. There you go. Without resistance, go ahead. Okay, and now I'm gonna do your hand. Go ahead. Okay, and then turn it around and then down. Okay. So now you're gonna hold my fingers and you're gonna squeeze hard as you can. Okay, strong grip. And you're gonna show me your hands like this. Okay. Okay, capillary refills this in 2 seconds. I'm just gonna pull your watch a little bit up for me and turn your hands like this for me. I'm gonna get you a little bit on my knees. I'm gonna check your radial pulse. Relax your hand here. Thank you. Okay, so radial pulse is equally bilaterally +2. Skin, it's warm and intact, and skin color is within tone of the patient's race. So now what I'm going to be doing, I'm going to be auscultating your lung sounds. I'm going to be checking first anteriorly, then posteriorly, which is your back, and then going to be lateral, which is side to side, okay? So I'm going to adjust my stethoscope here using the diaphragm, okay? So you're going to take a deep breath first, and then you're going to blow it out through your mouth. So inhale through your nose, exhale through your mouth. Go ahead. Again. 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 Okay, I'm gonna go under. Again. Again. And then the other side. Go ahead. Okay. So now you're gonna turn around for me, please, and I'm gonna check posteriorly. Take a deep breath. 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 And one more over here. And over here. So starting with the left side, I'm gonna check on the side. There you go. Take a deep breath. There you go. Take a deep breath. Okay. Now you're gonna turn facing me, and I'm gonna check the opposite side. You can place your arm like this in your hand. There you go. Take a deep breath. And take a deep breath. Okay. So now, before I move to another aspect of the assessment, which is going to be your abdomen, I'm going to be assessing your mouth. Can you please remove your mask for me? And you're gonna look a little bit slightly up for me. Okay, can you say up for me? Stick your tongue out. Okay, mucosa is pink, skin is intact, patient's not missing any teeth, and teeth are pretty white. Okay? And can you look all the way up for me? I'm gonna take a quick look at your nose. Okay, mucosa is pink and moist, and septum is midline. Okay. Any difficulty breathing?
No.
No? Okay, can you just cover one of your nostrils? And can you take a deep breath? Okay. Release. Now the other one? No difficulty breathing? No. Okay, so now I'm going to be going and assess your abdomen. Can you please lay down for me?
Yes.
When was the last time that you used your restroom for avoiding, for urination?
2 hours ago.
Okay, and what was the color like?
Light yellow.
Okay. Did you have any burning sensation or pain upon urination?
No.
Any urgency or frequency?
No.
Okay. And your menstrual periods, are you regular or irregular?
Regular.
Regular, okay. When was the last time that you had a bowel movement?
This morning.
This morning? And what was the aspect? Can you describe it?
It was well formed and soft, brown.
Okay. So what I'm gonna do, I'm gonna start by assessing your abdomen. Can I pull your pants a little bit lower for me? Okay, thank you. A little bit more, thank you. So I'm just gonna be assessing. So the abdomen looks round. Okay, and okay, good. So now I'm gonna be auscultating your GI sounds. I'm gonna start with the right lower quadrant using the diaphragm. There, right upper. Left upper. Left lower. Okay. Now I'm gonna percuss. Okay, on this next step, if you have any pain, let me know, okay? Any pain?
No.
Yeah? No? Okay. No pain?
Mm-mm.
Okay. Okay, so patient's abdomen, it's round. There's no abnormalities noted. And the skin is appropriate with the patient's race. His skin, it's warm and even tone. Okay, so now what I'm gonna do, I'm gonna be moving to the lower extremities. Can you lift this leg up for me? Thank you. Now this one. Okay. Now I'm gonna be checking the patient's feet. Okay. So can you flex your feet for me up with resistance? There you go. Now without it. Okay, good. Full range of motion on the lower extremities. I'm gonna check your pedal pulses. Okay, they're rhythmic bilaterally +2. I'm gonna check also your toenails for capillary refill. Let me press on all of them and okay. Okay. Does this pants go a little bit high or not?
Yes.
Okay. So here I can see that the skin is regular tone for appropriate for patients' race, and the skin is warm. Have you had any accidents recently, like any falls, anything that you can potentially know that you or is causing any pain? No pain at all so far. Okay. So next thing, what I'm gonna be doing, I'm gonna be just checking to make sure that there's no dryness or nothing between your toes. And you don't have any medical conditions, correct? No diabetes, hypertension, and so on, correct?
No.
Okay. Okay, skin is intact and it's warm. Okay. So now what I'm going to be doing, I'm going to be lowering the bed to the lowest position. I'm going to be putting the collar within the patient's reach. There you go. I'm going to open the curtain And I'm going to remove gloves and perform hand washing per CDC guidelines. Before I leave the room, is there anything else I can help you with before I document my findings and give the report to the physician?
No, thank
No?
you.
Okay.
Move up to your head. So hair texture is curly and thick. Hair is brown. There's no masses or lumps or lesions. No infestations. The head is proportionate to the rest of the body. The face is symmetrical. The eyes are brown. Do you wear any visual aids? Okay. The sclera is white. The conjunctiva, I'm just going to pull your eyelids down. They are pink, shiny. The nose is symmetrical. Are you having any pain? I'm going to look at your nose. No redness or discharge. I'm going to check your ears. Patient does have earrings on both sides. There's no discharge. Do you wear any hearing aids? Okay, now I'm going to do your mouth. So the lips are pink and moist. Can you open for me? All teeth are present. The gums are pink. The tongue is pink. Now I'm going to assess your neck. So the trachea is midline. No JVD on either side. Now I'm going to be assessing your lung sounds and your thorax. So the thorax is symmetrical, no barreling noted. So I'm just going to be listening for each inhalation and expiration. I'm going to start above the clavicle. Okay, just breathe in and out. Go below. Okay. And just check on the side laterally. Okay, now can you turn around for me? I'm gonna check the back and I'm gonna go around the scapula. Just breathe in and out again. Lung sounds are clear, equal and bilateral in the anterior, the posterior, and the lateral sides. Are you having any cough?
No.
Do you have any sputum or mucus coming up?
No.
Okay. Now I'm going to be assessing your peripheral and your cardiovascular. So first I'm going to start with your nail beds. So nail beds are pink. Capillary refill is less than 3 seconds. I'm going to do it in your feet as well. And they're pink as well, less than 3 seconds. No edema in the feet, the ankles. Let me see your hands. No edema in the wrist or the hands. Can you make a heart for me? Okay. There's no clubbing noted in the fingers. Now I'm going to check your heart sounds. First, I'm going to start with the aortic on the right, intercostal, second intercostal space. Then I'm going to do the pulmonic on the left, second intercostal. The Erb's point on the third intercostal midclavicular. The tricuspid on the fourth, and then the mitral, and I'm gonna listen there for the apical for 1 full minute. Okay. Heart sounds are heard in all regions with regular rate, rhythm, and strength. Now I'm gonna check your pulse sites, so I'm gonna do the Carotid Pulse, 1 on each side, 1 at a time. Then I'm gonna do the brachial together. The radial. Do you mind putting your legs up here? I'm gonna do the posterior tibial and the dorsalis pedis. And then pulse sites have regular rate and rhythm with a rate of 89 beats per minute. Now I'm gonna assess your abdomen. Can you just lay flat for me? And I'm gonna assess or inspect it at eye level. Abdomen is rounded. I'm gonna listen and auscultate your bowel sounds. I'm gonna start at the right lower quadrant, and then the right upper quadrant, left upper quadrant, left lower quadrant. Okay. Now I'm going to palpate lightly for any tenderness, and you just tell me if you're having any pain. Okay, I'm gonna start down here and go up, over, down. Are you having any pain? Okay, there's no tenderness. I'm going to now do it more deeply, and just tell me if you're feeling any pain there. I'm checking for masses. Okay. Okay. Okay, you can sit up for me. And then the abdomen is soft. So now I'm going to be checking your musculoskeletal. So just turn around and bend over a little bit for me. I'm going to be checking your spine. Okay, spine has normal lumbar curvature. You can turn around. We're going to do range of motions. So just do your head like this for me. Do your arm up and together, out and in, and then do your left leg, boom, you're fine. And then the other, boom, boom. So patient has range of motion in all 4 extremities. Do you mind having a seat for me? Now I'm going to be assessing your joints. So I'm going to be checking for pain, swelling, crepitation, redness, edema. Okay, I'm going to be checking in your elbows. Okay, any pain? You bend them for me. I'm going to check your wrist. Any pain? Go in your fingers. Can you fold them on mine? Do they have any pain? No. Okay, can you put your legs up here? Be checking your knees. And I want you to bend this one. Any pain? No. And then I'm going to do this one. Okay, and then rotate your ankles. Any pain with that? No. Okay, there's no pain, redness, swelling, crepitations in the joints. Patient is able to bear weight on the legs. Do you mind standing back up for me? We're going to check your gait. Just walk that way for me. Okay, gait is, you can have a seat. Gait is smooth, rhythmic, and steady. So now we're going to move to your neurological, and we're going to first, can you tell me your name again?
Amia.
And where are we?
Baptist.
And what year is it?
2022.
And patient is alert, awake, and verbally responsive, and they're oriented to person, place, and time. So now I'm going to check your strength and your sensations. So I want you to lift up against my hands. Do your hands like this, and push, and pull, and squeeze my fingers. Okay, legs up here. I want you to lift up and then pull towards me, and then push and push. All right. So patient is able to show strength in limbs. I'm going to touch on your face, and you just tell me where you feel it.
Left forehead. Right cheek. I mean left cheek. And right chin.
Okay. Patient has.
All right, so if you can pick an object in the distance and look at that, I'm gonna check your pupils. I'm gonna move your hair just a minute for you. All right, that's good. And then I'm gonna check. Perfect. Now, if you could look at this pin, and then when I tell you to look in the distance, okay? Now look in the distance. All right, look back at the pin. Look in the distance. Perfect. Do the same thing again. Look at the pin. Now look in the distance and look back at the pin and in the distance. Perfect. That's exactly what we want to see with that. Her pupils and the exam with that, everything was normal. There's pupils are equal and reactive, round, and accommodating to light. Now I'm going to go ahead and use the ophthalmoscope, and I'm going to look in her eyes to check for her red reflex and the disc and retina. So I'm going to come in at you. I'm going to check your left eye first, and I'm going to do that by using my left eye, okay? I'm going to put my hand on your head just for support. All right, there's the red reflex. Disc is noted. It's got clear margins. There's about a pale orange color. I can visualize with the retina the vessels, the veins and arteries, and the junctions. I don't see any abnormal masses or any swelling in this eye. So, okay, I'm gonna come around and I'm gonna check your other eye and do the same exact thing. All right, got the red reflex. I'm gonna come in here and I'm gonna check. And again, I can see the disc, and it is pale orange. I can note that there are not any masses or lesions noted. And again, I visualize the vessels and the junctions, and this eye too has no swelling noted. I also note that there's no opacities. Very good. All right, I'm going to check your head, and I'm going to visualize that it is symmetrical. Lights. Oh, I will turn the lights back on. Your head is symmetrical. I don't see any abnormalities at all. Skin is pink and no lesions noted. I'm gonna go ahead and come from behind, and I'm just gonna check your hair, okay? So her hair is, it's fine to touch. It's a normal fine texture. Color is purple currently, and I'm looking good hair distribution. There's no nits, no evidence of any lice, no masses, no lesions. Does any of that hurt? And no tenderness. I can't palpate any masses or lesions or anything like that at all either. So I'm going to go ahead and I'm going to look at your ears, if that's okay. Let me change out my ophthalmoscope onto my otoscope, and I am going to take a look at your ears. Your hair is a little bit in the way, so if you could push. Perfect. Thank you so much. Can't get my thing back on here now. Okay, so on inspection, her ears are symmetrical. They're in the appropriate place. They're not too high, they're not too low. And I don't see any lesions or masses or anything like that with her ears. So I'm going to go ahead and I'm going to set this down for just a second, and I'm going to palpate your auricle and your mastoid and your tragus and look around. And does any of that hurt? Any tenderness?
No.
Okay, perfect. Now I'm going to look inside your ear, and this won't hurt. And I'm gonna just check and see. Can you tilt your head just a little? I'm gonna pull your ear back and see what we can see in here. The ear canal is pink. I don't see any signs of redness. There is a little bit of earwax. I can visualize the tympanic membrane, the cone of light, the bony structures. Everything is intact, and there's no redness, swelling, or discharge noted. So I'm going to go ahead and do that again on this ear, okay? First, we're going to check and see, do you have any tenderness at all? Okay. The ears do look good. There's no abnormalities or lesions noted. I'm going to, again, go ahead and look in your ear. And this ear canal also is pink and has just a little bit of earwax in it. There is the tympanic membrane. The cone of light is noted. The bony structures are normal. I don't see any bulging. There's no redness. There's no edema, and there is no discharge. Are you having any pain with either of your ears? Okay, perfect. So your ears look really good. Now I want to just take a look at your nose and note that you have a very symmetrical nose. I'm not seeing any masses or lesions or any abnormalities. So I'm going to take the otoscope again, and I'm just going to look in your nose. And yeah, tilt your head back just a little bit. Thank you. All right, her nasal cavity is pink. It's clear, a little bit of clear drainage. There's no indication of any abnormalities. There's no polyps, no lesions. I'm gonna look in your other nostril, and it too is pink and moist, and there's just a little bit of clear drainage. The septum looks to be in normal position. No polyps, no lesions, no masses. That's good. Now I'm just gonna touch your nose for a minute, okay? I'm just gonna make sure that everything is feeling good. Okay, let me check your sinuses. Is there any pain here? No? Okay. What about here? Any pain?
No.
Okay. Now I'm gonna close this off. Can you breathe in and out? Perfect. And again. Perfect. That is wonderful. Now I'm gonna go ahead and look at your mouth. Your lips look good. They're pink. They're moist. I don't see any scaling. I don't see any abnormalities, no lesions, nothing like that. So can you open your mouth and stick your tongue out? And can you move your tongue up and down and left and right? Perfect. Tongue is pink, moist, no lesions, no abnormalities noted. Your oral mucosa also pink, moist. Let's see your teeth. Open up a little bit. There you go, perfect. I don't see any dental caries. Gums are pink, gums are moist. Appears she has an ulcer right there. Do you get canker sores? Yeah, okay. Let me look at the roof of your mouth. I don't see any lesions, masses, any redness. Everything is pink. Stick your tongue back out for me. Check your throat. Tonsils are 1+. The pharynx is pink. It's moist. There's no cobblestoning. And the uvula moves up and down as it should. Perfect. I don't see anything of abnormalities with your mouth. So I'm going to go ahead and I'm going to check your neck, and I'm just going to look, and your neck is symmetrical. I don't see any masses. I don't see anything protruding. Your trachea looks like it should be in the right spot, as does your thyroid. I'm going to go ahead and I'm going to check your lymph nodes, and I have to do that by starting up here touching your hair. So I'm going to go back behind your ear, And I'm just gonna feel, I don't know, it can be ticklish at times. Does any of that hurt? Okay. I have to come all the way down here because there's lymph nodes that they go far. Did any of that hurt where I've touched? Okay, and I didn't feel anything with her lymph nodes, non-palpable. And I'm gonna go ahead and have you swallow. Okay, I was checking your thyroid, that feels appropriate. And I'm gonna push your trachea over just a bit, both ways. And that is where it's supposed to be, it's midline. All right, I'm gonna come behind you here, and I'm also going to have you check I'm also gonna check your thyroid from the back, okay? And can you tilt your head back just a little bit? Perfect. Can you swallow? Perfect. I don't feel any nodules, no masses, nothing abnormal. It's in the appropriate position. Trachea is also in the appropriate position with no abnormalities noted. Now I'm going to check your range of motion. So can you put your chin to your chest? And then put your head back. And then can you look side to side? Perfect. And then put your ear to your shoulders. Perfect. That looks really good. I'm just going to check this really quickly here.